Embarrassing bladder leaks does not have to be part of your life. If you are someone that has struggled with leaking a little bit when you cough or sneeze, or when you're walking real fast or doing an activity that you love, it can be embarrassing and you don't have to live with it. In fact, millions of women are affected by having bladder incontinence at some point in their life, after pregnancy, during perimenopause or menopause and beyond, or after a surgery like a hysterectomy. Well, it doesn't have to be this way, and there are natural solutions besides the advice that a lot of women are given to just do Kegel exercises and just work on tightening the pelvic floor all the time. Oftentimes, Kegel exercises can make your symptoms worse if those muscles in your pelvic floor are tense and restricted. They aren't going to want to strengthen and tighten all the time. So in this video today, I'm going to show you 3 powerful exercises that are going to transform your body so you can start being more consistent with a program that actually works to help your bladder incontinence. These exercises will help regain bladder control, strengthen your pelvic floor, and stop those embarrassing leaks. You are going to learn how to engage those muscles in the right way. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist and women's health physical therapist. And oftentimes women are told it's just their age, or this is what happens as a female. It's really not fair, and it shouldn't have to be that way. You can find natural solutions to really help you overcome this embarrassing problem so you don't end up like your mother, your grandmother, or great-grandmother in a nursing home wearing diapers. And unfortunately, down the road, many women develop incontinence. But good thing you're watching this video, because you're going to learn these 3 exercises that you can do on a daily basis to start training those muscles in the right way. This is helpful for any woman. So it's not just about a weak bladder or a small bladder. It's really about posture, it's about control, and it's about using your muscles the right way. So number 1 is diaphragmatic breathing. Go along with these exercises on a mat on the floor, or even laying on a couch or a bed as well. If it's difficult for you to get down on the floor, these can still be very effective if you can get to a position resting on your back with your knees bent. Okay, as you can see, when I'm on the floor, I'm gonna place my hands over my belly, not up here by my chest or ribs, but right over your stomach. And you're gonna imagine breathing into your hands with an inhale. So you will relax the neck, chest, and shoulders, and just feel the belly rise into your hands. And then as you exhale through your mouth, you'll feel your navel sink in. So you're gonna just breathe back and forth, just feeling the rise and fall of your belly, and imagining that you're opening the pelvic area through your hips by getting the air down into that lower abdominal area and down through your hips. So do about 10 slow, deep breaths. Diaphragmatic breathing is moving that diaphragm muscle, that's your breathing muscle, at the bottom of your ribs, and it makes up the top part of your core. So as we're filling the lungs and allowing our belly to rise and fall, it's taking away the breathing that we usually do from our chest. And so follow that along, do about 10 slow, deep breaths, and you may feel all this area start to relax and let go. If you're having back pain, you may even feel a little less tension in your back if you practice this. Okay, this next exercise is a pelvic floor drop and lift. I'm going to show it in a kneeling position, but if this bothers you to be on your knees, you can absolutely sit in a chair, be comfortable as you're doing it. But the point is to be in a gravity position, so we're not on our back for this one, but more upright. Now I'm going to imagine this pelvic area like a bowl at the bottom, and that basket is going to drop and let go, and then it is going to recoil and contract. Now, I did talk about Kegels, and if you don't know what a Kegel exercise is, think of your muscles when you go to the bathroom, like you're squeezing and holding, cutting off a stream of urine. And it is more important to actually learn how to let go of those muscles, but not bear down and push out. You want to imagine if that area at the bottom part of your pelvis If it's a hammock, that hammock is just being stretched out just gently. So as you take a big inhale through your nose, you're allowing those pelvic muscles to drop and let go and lengthen. And then as you exhale through your mouth, you're going to imagine a blueberry coming up through that vaginal opening and all the way up and drawing in and up. And you may feel a little tension in that lower abdominal area. So inhale, release those muscles. And then exhale, think of zipping up and drawing in and up, starting with the pelvic floor first. Don't tense and tighten your glutes too much, okay? We're gonna do that in another exercise, but let's just think about this part through your core working instead of all those accessory muscles too. So try 10 of these. Inhale, we allow those pelvic muscles, almost like a flower is opening up. You're letting them go. And then as you exhale through your mouth, you're imagining pulling in and up that blueberry, lifting up through the pelvic floor. Follow along, and you can even pause it here, do 10 reps of that exercise. This can be great to carry over into a standing position. Nobody knows you're working on it. You can be in line at the grocery store and also still work on this exercise. So same amount of time you allow those muscles to let go and open, then the same amount you imagine lifting in and up. Don't stay lifted and tense all day long. You want to be able to work on the inhale and letting those muscles go. So important. Okay, exercise number 3, more functional glute and core related exercises. I find that so many women with bladder control issues or prolapse, they are struggling with being weak in this whole area. So oftentimes when we start doing Pilates or we start doing more isolated squats, deadlifts, things like that, that are really gonna work the hip muscles and the core and work on the breathing with it, their symptoms improve tremendously because they're not really isolating and training those muscles like they should. So in this exercise, you're gonna be again on your back with your knees bent. We're gonna go into a glute bridge. And as you lift your bottom off the floor, you're gonna imagine pulling those muscles in and up just like we did on the last exercise, but I'm tensing and using my glutes this time and tightening those muscles too. And then I inhale on the way down, I let everything go. And then I exhale, engage those muscles, pull them in and up, squeeze through the glutes. So start with both legs on the floor, doing this about 10 times. And then if you want to make it more challenging, we can go into a single leg bridge, single leg glute work. You can even have your feet up higher on a box or something on the edge of a couch, something more elevated, and therefore you can get more range of motion. But we don't want to flare the ribs up. We want to stay connected through here so we don't overarch our back. But going up into that glute bridge, you're going to get more range of motion in hip extension. And this is very helpful for your posture, your strength, all through the backside of your body and also through the core. And then work on about 10 to 15 reps of that glute bridge exercise as well. So why do these exercises work? Well, they strengthen and they work on effective movements without extra tension. We don't want to always tense this whole area, but you are encouraging the breathing, the alignment, the posture, the overall focus on what your pelvic floor muscles need to do, which is that bottom support for your bladder. Also, these exercises, simple to do, just a few minutes a day. You're carving out, you can do them in the morning, you can do them in the evening, and work them into your day, and you will find that you are going to think about these muscles more often the more you're training them. The better your brain is trained, the better your bladder will respond as well. So have you tried any of these before? Have you already started on some kind of exercise program to help your bladder symptoms? Let me know in the comments. I have a very helpful pelvic floor Pilates program. In just 15 minutes a day, you can work on these specific exercises for the core and the pelvic floor like no one else, and be able to work on the most effective Pilates-based exercises as a woman, especially as a woman over 40 that needs to work on their pelvic health. And with this program, following it for 4 to 6 weeks, you are going to feel stronger, more confident about your body, and just be able to take control when this area learns the correct way to be able to relax and let go, but also the best way to strengthen. So thanks so much for watching this video. I hope you join me again in another video, and we'll see you again soon.